Dear colleagues, dental students everywhere, peace be upon you. This is an introduction to a short video speaking about two tricks in the open sinus lift technique. The first trick is the burr used for this technique. Burr used for open sinus lift technique must be dull diamond burr. Dull diamond round burr. So it means that it may be anywhere that's old in your clinic and you didn't use it for a long time, so you can use it now and it's of great benefit to you to make a tunnel in the bone at the wall of the sinus, at the lateral wall of the sinus by this burr, because this burr cannot injure the sinus membrane at all. If you'd like to be sure of that, you can try to remove, for example, any hyperplastic tissue in the gingiva by this burr. You will find that this burr cannot remove the tissue at all. So it means that this burr is very safe for this sinus lift technique. So you have to open the window of the sinus at the lateral wall by this round burr to make a demarcation of the window and then reflect it upward, and as we will see in the next short video. The second trick is an integrity test. You have to make the integrity test of the sinus membrane. What this integrity test? It means that you after you open the window and elevate the door upward to make a cavity that will receive the bone graft and receive the implant, you can ask the patient to make inspiration followed by expiration multiple times. This multiple expiration and inspiration will show you that the door moving up and down many times. This means that the sinus membrane is intact and there is no perforation. Because if there is any perforation, this movement will not happen and you will hear a sound of air coming from the sinus. So these are the two main tricks you have to take into consideration in the open sinus lift technique. I hope to enjoy this short video to show these two tricks. Thank you very much. As you see here, we raise the pyramidal flap, pyramidal microostal flap over the sinus, lateral of the sinus of the upper right six of the patient to make a sinus lift in a classic way. Then, as I mentioned before, we use the dull round diamond burr to demarcate the margins of the window that will be raised, and we deepen these demarcation until we see the shadow of the sinus membrane, which is bluish in color. Increase the demarcation to reach the area and the depth that I want. After this good demarcation and limitation of the window, now we can use the other instruments, looks like hand of the mirror or something like that, to make a gentle knocks over this door of the window that open at the lateral of the sinus to release any catching, and until we obtain this door is loose. Like you see now, it's loose under my instruments. So I start to raise this loose door upward by the special instruments and special elevators of sinus lift to upward to make it as a roof of the implant that will be seated in this area. After this elevation of the door upward, then in this condition we should ask the patient to start this action of inspiration and expiration, as I mentioned before, to be sure of the integrity of the sinus itself. This movement denote and ensure that the sinus is completely intact and there is no perforation of the sinus at all, because there is no air coming outside, but the door is moving upward and inward many times, as you see in this video. So by this way you are sure that your work is perfect and there is no perforation. Thank you very much, and I hope you enjoy this short video, and for the next I'll put another video for the whole process of the sinus lift.